Welcome to The Treatment Plan, a podcast about how healthcare really works, from weight loss and patient care to the systems and incentives behind it all. Hosted by Jack Usher and David Usher, MD. So I can set the field here for just people who've never heard of this.
Okay.
What is ICRA? ICRA, ICHRA, that's the Individual Coverage Health Reimbursement Arrangement. It's a mechanism by which employers reimburse employees tax-free for individual health insurance premiums and other qualified medical expenses. So this is relatively new. It was established via regulation around 2020, meaning its legal standing depends on administrative rules rather than law, which is why there's now a debate about the Choice Act, or the Choice Arrangement Proposal, and choice, that's choice in all caps, stands for Custom Health Option and Individual Care Expense. Choice.
Oh.
Yeah.
Okay.
There you go.
So the choice thing would be legislated as opposed to regulated.
Correct.
Right? So that would be something that, like Obamacare, would just become law and not subject to administrative whim, I guess, if you will, right?
Correct.
In that sense.
Correct.
So, yeah, very interesting.
Yeah.
It's like another chink in the armor of the Affordable Care Act. All those Affordable Care Act weaknesses, let's call them, right? Because obviously people are still, the whole government shutdown supposedly is around this subsidizing the latest version of Obamacare, and the Democrats are willing to die on this hill, which is okay. But it's it's like an extra add-on to what was already there, as I understand it, these subsidies, and then and now they're going to bat for these and risking all their political standing with much of the country on this government shutdown over this issue. It's really a fascinating thing to watch.
Yeah.
But they would do that. I'm not sure what the gain is for them.
Correct.
They keep
I agree with
talking
you.
about pandering to their base, but I'm thinking, where's the base going to go? You know, other than primary them all.
Yeah, right. Yeah, it's I guess the government shutdown, of course it's political and it's kind of unavoidable in this context, because that is the crux of the issue, is just healthcare spending and premiums and tax credits for Obamacare. And the commentary I saw that I thought was really funny is, if it's affordable, why do you need to subsidize it so heavily?
Precisely.
Yeah.
It's because of Obamacare, you need to subsidize Obamacare.
Yeah.
Yeah.
It doesn't make sense.
It's completely self-propagating, self-perpetuating problem. Keep subsidizing things, and guess what? The price goes up.
Yeah.
So now we have to subsidize again. It's like the issue for Democrats that will never go away. It's like Social Security and every other government welfare program. It's just an issue they can keep dredging up and bludgeoning the people who would not fund it or would cut the budget or, try to reform it. It's like a third rail item, but thank God somebody's willing to step up and not let it become that third rail item, because this is crazy.
Yeah, and some people in the media, I know this is a long tangent about politics, but it is unfortunately the reality of healthcare in America, is that it's become there's a heavy hand of government involved. And unfortunately that drives a lot of decisions. It drives like we've talked about before, Medicare, Medicaid, CMS is the 8,000-pound gorilla in the room.
Right.
In so many ways. And that's all legislated in one way or another. Maybe some of it probably hasn't been touched in 80 years.
Right. Well, the last person who tried to touch it, I think, was Paul
Ryan.
Paul Ryan, out of Wisconsin, and look what happened to him.
Yeah, and he is no longer speaker and no longer in Congress.
He wanted to do the defined contribution approach, which is somehow related to the ICRA discussion, or like 401k is to pension plans. He wanted to do that with Medicare, basically say, we'll give you a set chunk of change. you buy your own health plan.
Yep.
And that, yeah, that was his demise. That led to his demise, I think.
Yes, it
Or at
did.
least I understand, as I
Hmm.
understand it. So, yeah, really a third rail issue. Do not touch that if you want to live in
Yep.
politics
In Washington,
in
for
Washington,
sure.
right? Yeah.
Yeah, you give a lot of credit and respect to Paul Ryan because he not like he didn't know that was what was going to happen.
Oh, right, right. Yeah,
Yeah,
somebody had to
he
say it,
right. He
right?
went for it anyway. Yep. And he
Mhm.
was, Paul Ryan was. We gotta shout out Paul Ryan, of course, because we're Wisconsinites and he's a
Right?
Wisconsin guy. He he was the chairman of the Ways and Means Committee, which is
Right.
arguably the
He
most
understood
powerful
all of this,
seat.
right?
Yeah, yeah.
They
I
had
mean,
to
he was.
appropriate the funding and all of those things, and
Yeah, he was the man on the Republican side in the House because he was Speaker, obviously, but he was also before that the chairman of the Ways and Means Committee, which is the primo spot after Speaker.
right,
And yeah, I mean, he tried to take on kind of the big issue and just didn't. He's taken down for it pretty much.
right. The time wasn't right.
The time exactly time wasn't right. There was not clearly enough political pressure, despite the Tea Party wave of 2010 and the kind of that movement wasn't enough to really make something happen. But anyway, all that to say is ICRA becomes a thing 2020. That's 5 years ago now. The choice proposal has not made it into law yet, but the explain like I'm five version is instead of employers buying a health insurance plan and you as the employee enrolling in it, they actually give you the money instead, and you go out and
Right.
buy your own health plan. Am I understanding that correctly?
Yeah, that's the essence of it. It's it's Obamacare, in that there are certain criteria that the plan you purchase has to meet Obamacare, um, qualified plans, minimum essential benefits, and things like that. So, and affordability, and no pre-existing conditions, things like that. So when the person goes out, so if I'm the employer, which I am, who says we're going to provide an individual coverage health reimbursement account or arrangement for you all, and here's how it works. For those of you who are interested in taking us up on this, basically you have to go find a qualified health plan somewhere, and a lot of this depends on the strength of the individual market in your area, right? If
Mm-hmm.
if there was a time with the Affordable Care Act where there was literally only one health plan offered through, um, in Wisconsin, effectively it's healthcare.gov, because we decided to just let the feds run the show on the state marketplace. Um, and why incur the cost, because the feds are just regulating it all anyway. So um, there was literally at one point there was just one health plan. So um, so if you gave people an ICRA, they didn't have any more choice than if you offered a health plan. Uh,
Right, which
I
is an
don't
important note.
Right, yeah, because are you giving people choice? Maybe not. If there's only one or two, plans to choose from. But if you have um, dozens of plans or lots of plans that you can choose from different companies and different levels, things like that that you can buy, you might well find it beneficial to have some options that maybe your employer can't do, particularly if I really get a kick out of this. The Obamacare defined what's a large employer as 50 employees,
Yeah, we talked about
you
that a
know,
little bit last
full
time.
time.
Yeah,
Like, okay, that I don't see us as a large employer, but that's where under Obamacare we are. So,
yeah.
um,
By the way, that just tells you what kind of non-business people wrote this law.
exactly, yeah,
Yeah.
it was completely a socialist move. So, um, um, so anyway, if you send your people out, they can buy something, bring you the receipts, basically. I mean, this is really simplifying it. And your job then as the employer is to make sure that what they bought was um, uh, met those minimum criteria, and that the amount of money you're giving to the individual allows them to purchase that plan without spending more than like 8.6% or something of their household income, that's another really seriously interesting thing. I have to know how much your total household income is. So what if that sounds kind of intrusive? To ask what your spouse makes and what is your,
Hmm.
um, what kind of income you got coming in off of rent or whatever. I mean, I don't know how in depth that goes. But there are companies out there now, and I think you turned me on to one of them that are doing management of these ICRAs for employers, so the employers don't have to get mired down in all those details,
Hmm.
which is fascinating. It's how the market works, right? Pass a law that creates complications, and a bunch of other people will pop up with ways to make money off it.
Right.
Um,
Yeah.
but ICRA is an
Double-edged sword.
improvement over having to take the risk as an employer
Yeah.
to buy a health plan and then deal with the premium increases year over year that you can't do anything about. And
Hmm.
it's a way of defining your contribution, which is again more the 401k model and less the um, pension plan model.
Correct. Yeah. That's and for the people that the company in particular that we're talking about was written about by a guy named Packy McCormick in his newsletter. Not boring. The name of the company is Thatch, and
That
they're basically doing what you described as management. It's a software tool. It's a platform to help employers manage all of the administrative overhead that comes with doing an ICRA plan.
hmm hmm
So they're just enabling employers to make it a more feasible alternative or option to provide healthcare or to
right.
provide, I guess, to provide healthcare to the employees through this regulation.
Yeah, and so everybody understands that Thatch is one that I've heard of. I've watched another YouTube video with a guy from another company. I think they call it Take Command,
Mhm.
which is a plan, I guess, through Oscar is the name of the bigger company.
Oscar, yeah.
Um, and when I look into the state of Wisconsin, there's a bunch of plans, a bunch of companies around doing ICRA management for employers as well. Um, so that this is not an advertisement or sponsor. That's just not our sponsor,
Yeah,
or,
no
or,
affiliation.
nor is Oscar or Take Command. But they are things that we have seen. Um, the point is this space I think has a lot of room for growth, and that not boring article that you were talking about was really it was like one of those things. Sometimes I pick things up that I look at and go, ugh. And this one I just couldn't put down. I had to plow through the whole article. It was just
Yeah.
so fascinating. And the way they
Yeah,
did
Packy
talk
writes
about it.
great stuff, by the way. All of his stuff. He covers a bunch of different vertically integrated companies and stuff, and he does a really good
It
job.
was
He's
definitely not boring to read,
yeah.
from my standpoint. But yeah, I mean, it's in a way, if you think about it, with these ICRAs, if you don't have a real robust individual health plan market in your area or in your state, as this ICRA grows, the more and more employers that are using it, the more and more individual health plans will move into the marketplace um,
Hmm.
to grab a piece of that market. So
Opportunity, yeah.
opportunity, yeah. So
And
it
that's what I wanted to highlight that because that's like you said, there was just one health plan provider in Wisconsin, but it's like a catch 22. It's like who wants to provide a who wants to provide choice when there's no choice,
right,
but who wants to enter that market from the supply side given it's kind of like you need some sort of regulatory breakthrough or change to kind
right,
of kickstart the whole market.
right. That's what ICRA is doing, right?
Exactly. Yeah.
Yeah. And it's taking a little while for people to understand it. I mean, self funding has been a great thing for a lot of companies, and
Hmm.
but there is um, a certain amount of mm, let's say ownership and work that goes along with that. There are companies now. One Self Fund Health is one in Wisconsin that's popped up to just kind of do all that work for you. with all the little pieces, parts in place that are, kind of high value options for you, including your TPA and your third party administrator and your direct primary care option, so forth. All the things that make a really great self funded health plan successful. They've kind of packaged an approach to that employers can just come to and say, "Hey, I want you to do our self funded health plan," and they'll step in and do that for you. So lots of interesting responses to the market currently.
Yeah.
It'd be really nice to get to a place where the Affordable Care Act just kind of dies of, not neglect, but really, there's a word for it, just lack of need, right? I mean,
Yeah,
like,
it's abandoned.
it's abandoned, yeah. But I mean, to Barack Obama's credit, despite the fact that I think he was just lying through his teeth the whole time talking about it, he put something in place that we will probably all look back on if we don't now and say, okay, that really needed to happen in the sense of pre-existing conditions, and some basic standard for what we call health insurance. But
Yeah.
then I would say the only reason you needed a really basic standard was because of all the rules through ERISA and other federal government laws that required certain things to happen as well. But um, even though I don't know if Obama knew this or not, but I mean, it could only he told people, "Oh, it'll save us $2,500 per
Yeah.
household
Right.
or
Right.
something." I mean, that was just a lie on its face, and there's nobody could with two brain cells to connect
Yeah.
together in the same skull could look at this and go, "Oh yeah, that's going to save us a lot of money." Like,
Hmm.
it's either
Well, one
you
of his
I'm either
staffers
going to pay
brought.
you in taxes or I'm going to pay for my insurance. And if you're going to say that you're going to subsidize all these people, well, that's just basically a welfare program. Anywho, ICRA is going to be disruptive, is the point, and in a way that I think is going to be a net positive. But it's going to take time to roll out, for people to understand it, for people to use it, for the marketplace to respond. Um, but it's got to be, in some ways, for the business community, for people
Mhm.
who own small businesses in particular. When I say small, I'm talking less than several thousand people, not medium sized businesses, but the really small businesses, the qualified, the QSARAs had been a thing for a while, but people with employers over 50 who are not big behemoths, that mid-sized company and maybe small companies, I think those are, um, I think it's going to be a nice option. We'll see. As long as but with these companies coming in who are able, if they can, in a reasonably affordable way, manage these for you, uh,
Mhm.
then I think and then you get off your risk table, ever escalating premiums. You can kind of plan better for that
For sure.
as a business owner.
For sure. Well, we won't blow too much more hot air on this, but I do have the specifics about the choice arrangement that was
Oh, okay.
proposed.
Yeah,
So that,
let's hear about that because I would like to hear what yeah, if that's different, I'd like to hear how it's different from what exists currently.
yeah, so that this was put into the one big beautiful bill back in August or July, whenever
Oh
that
yeah.
was all going
Mhm.
through, and was eventually stripped out in the reconciliation or the conference process, the reconciliation process, whatever they call that. But here's what it says. It says what was the choice arrangement proposal. The key proposed changes were statutory codification of the ICRA rules, obviously. Two is employer tax credits for small business under 50 full time equivalents for offering choice. For example, $100 per employee per month in year one, 50 in year two. So they were going to give out tax credits. So that's two. Allowing pre tax salary deductions for premiums purchased on exchange or via the ACA marketplace, which is currently more restricted. Allowing small employers to offer both a group health plan and the choice arrangement to the same class of employees, which would be relaxing the prohibition that currently exists under ICRA.
Yeah, in ICRA, you can't do that currently, right?
Yep. And then shortening the required notice period for implementation from 90 days to 60 days. It sounds like those were the biggest, kind of most important changes. So employer tax credits for small businesses under 50 employees for offering choice. So a tax credit. Okay.
Which is actually money directly back to you, right? It's not just, it's it's.
Yeah, how the government does a majority of its handouts or whatever you want to call them, subsidies,
Right.
which are tax credits.
Incentive payments.
Incentives, yeah.
Mm-hmm.
Yeah, tax credits.
And with the idea
Pre-tax.
behind that less than 50, is that to move people away from ICRA options, or?
I'm not sure.
I wonder why they would use that size group to determine who gets.
See if I can find that out. But
a tax credit.
allowing pre-tax salary deductions for premiums purchased on exchange or via the ACA marketplace. In the same sense that you have pre-tax deductions for your health plans bought through your employer, like standard today?
Yeah, now pre-tax. Yeah, employees, what gets pulled out for their premiums, I think, just comes out pre-tax, as I understand.
Mm-hmm. Yeah, I see. Okay, so you were asking about the employer tax credit declining? Is that what you're asking about? Or
from what I remember you just reading was the tax credits were for small employers 50 or under.
Mm-hmm.
And there currently, I believe, exists a ICRA option, qualified small employer health reimbursement arrangement, if I remember correctly what that acronym means. That would be different, I presume, and or is different. And so I wonder if they're trying to move people toward or away from that with this. I'm not sure, but you don't. Once you get above 50, you can't do a ICRA.
Correct. Correct.
Yeah, I don't know. I'm not sure. Interesting to hear or read what the rationale is for what they would write into the law.
Yeah.
I suppose there are entire publications available to read those things, but I don't know for sure.
Yeah, so again, this never actually made it across the finish line, so
Right.
probably if it rears its head again, it'll be in a slightly different form.
Yeah, if you hear something about that when they start talking about choice in the future, at least you have some sense of what that might mean, right?
Mm-hmm.
Thanks for listening to The Treatment Plan. If you enjoyed the conversation, subscribe on YouTube, follow on Spotify or Apple Podcasts, and turn on notifications so you never miss an episode. And if someone comes to mind who'd like this show, tell them about it or send it their way using the share button.